Mr. Chairman, ladies and gentlemen, let me present to you impact of the innovative pelvic floor muscle training on the quality of adjusted life years in women with stress urinary incontinence treated by duloxetine. I have no conflict of interest. Stress urinary incontinence is one of the most common dysfunctions of the lower urinary tract which affects a woman's quality of life. Measuring of women's quality of life is very important to assess women's perception of health. This is based on the interaction of physical, psychological, social, functional, emotional factors, mental well-being, as well as a status of work, environmental quality, vitality, pain, fear, and depression. The aim of this study was to measure the impact of the innovative pelvic floor muscle training on the quality of adjusted life years in women with stress urinary incontinence treated by duloxetine. This analysis is a part of the study conducted between February 2019 and 2020. The clinical trial was a randomized intervention parallel multicenter study at the urological outpatient clinics at the national level for 12 weeks. Women were assigned in a 1-to-1 ratio to the experimental and control groups using simple randomization according to odd and even numbers assigned sequentially to the patients to each clinic. An estimated 63 women were required for each group. The standard inclusion and exclusion criteria were used. We used the following study design. The control group received oral duloxetine treatment. The experimental group received oral duloxetine treatment and IPFMT with lumbar pelvic stabilization. The IPFMT was performed 5 times a week for 20 to 30 minutes a day in cooperation with physiotherapists. The stress urinary incontinence was analyzed during a baseline and a final period according to the ICIQ questionnaire with range from 0 to 21. The calculation of the weighting factor was done by a linear transformation by the ICIQ score. The QALYS gains were calculated by multiplying life expectancy by a weighting factor. The study included 158 women, of whom 129 women were fully analyzed. All baseline parameters were not statistically significantly different between the two groups, but decreased more in the experimental group after 12 weeks of treatment. Before the treatment, the number of QALYS gained per life expectancy in control group was 7.5 and experimental group was 8.3. Following the treatment, the number of QALYS gained per life expectancy in control group was 15.0 and experimental group was 17.9. The number of QALYS gained per life expectancy was increased more in the experimental group. The number of QALYS gained was approximately 100% higher following duloxetine treatment, but combined duloxetine with IPFMT achieved 30% more. The combination treatment of duloxetine with IPFMT statistically significantly increased the number of QALYS and reduced the degree of urinary incontinence in women with stress urinary incontinence. Thank you for your attention.